don't let it keep you down. Don't let the fact that you will eventually receive a complaint from someone stop you from being excited about doing the job that you do. Because unfortunately, I know many doctors that have stopped working because they just fell out of love with the job. How's it going, everyone? Welcome back to the channel. My name is Gianluca, aka Dr. Calcagno, and I'm a final year medical resident in family medicine. I'm going to be opening my office in 5 months. 5 months is when my residency is over. And if you're me at this point in time, what you do is you sit down with yourself and you say, well, I'm not going on vacation when I graduate. Hopefully I'm going to pass everything. I know I'm going to pass everything when it comes to my exams, and I'm going to hit the ground running. I'm going to start seeing people right away. So then the next step is to start letting people know that you're going to be a new family doctor that's going to be accepting patients. In my area, the statistics are somewhere between 5,000 and 6,000 people are without a family doctor. So you gotta start getting the word out and just letting people know as you see them, if anyone's interested and looking. And one of the trends that emerged to me in the beginning when I first started telling people about this is people with family doctors already. So not that they're looking for one, but they had a family doctor. And many of them saying to me that they hated their family doctor, or that they didn't like the way that their office was, or they didn't like this particular thing with their staff, or they didn't like the way that their doctor spoke to them. And in the beginning, I thought that was actually kind of nice, because I thought that, this had shown that, their experience with me was better than had it been in the past with another doctor that they'd seen. But the more that I started letting people know, and as word started to get out that I was going to be accepting new patients, the trend that I started to notice wasn't just with one doctor, but with all of the doctors in the region, and with many different doctors that I've worked with and have so much respect for. And then it hit me that it is only a matter of time before those same people are going to have a problem with me. And that is super depressing as a new doctor going into practice and wanting to help as many people as you can. Let me clarify what I mean just a little bit more. Not to say that I think that I'm going to be a bad doctor, that's not it at all, but that the trend shows me that eventually, it doesn't matter how hard you try, unfortunately you can't make everyone happy. And this has gotten to the point so much so that towards the end of your final year of residency, they actually send some people in to talk to you. And one of the things that they say in terms of legal representation, and make sure you have good lawyers and pay your dues so that the CNPA and all these people can help you with legal troubles when they arise, is because they let you know that it's not a matter of if you will get a complaint, but when. And letting you know that almost every single doctor working at some point in time is going to get either a medical malpractice suit or a college complaint to one degree or the other, and you have to be ready for it. And I don't think any of us are. So I guess I'll start off going over this chart that I've pulled up here. This is from the New England Journal of Medicine, and it goes over the risk stratification of different specialties and how likely you are to become involved with a medical malpractice complaint as time goes on. And I'll put the chart up on the screen. What you'll notice almost right away, or something that stands out to me, is that whatever specialty you're in, if you're in a specialty that does more procedures, and that's why you see neurosurgery at the top, general surgery, cardiovascular surgery, they have a much higher risk of being involved in medical malpractice lawsuits because there is just more risk with a lot of the stuff that they're doing, and a lot of times those patients are a lot more sick. On the other hand, if you look at the bottom, family doctors, pediatrics, psychiatry, those are all specialties that have lower incidence relatively for medical malpractice. So something to keep in mind if you are going into one specialty or the other. Now, one thing that I want to get across in this video is that I am not defending bad doctors. I think, and many of you might agree with me in saying that there are bad doctors in the same way that there are bad everything. You could have a bad plumber, you could have a bad construction worker, a bad teacher. Similarly, those are bad doctors, and you try your best as a new grad to not be a bad doctor. That's why we're going through all these exams and all these rotations and all these evaluations that you have to do. But keeping in mind that 1/5 of all neurosurgeons will receive at least one medical malpractice suit on average every single year is a really scary prospect if you yourself are thinking of becoming a neurosurgeon. And again, one of the reasons why is because those people are acutely sick, and it doesn't matter sometimes how amazingly you've trained. Things go wrong. And sometimes they go wrong outside of your control. And on top of that, you also have to worry about the lifestyle and how stressful things are. And you see that, unfortunately. The other thing to note, though, is that on the other end of the spectrum, if you have medical malpractice suits over here, on the other end of the spectrum, you have physician complaints. Now, where on the one hand, you'll have the specialists that are doing more procedures for the most part tend to have more medical malpractice suits. In terms of number of complaints overall, this correlates more so with the volume of patients that you're seeing. And as a result, the doctors that have the most patient complaints on average tend to be the family doctors, the emergency doctors, the internal medicine doctors, the ones that are seeing a large volume of patients. And myself as a family doctor faced with all of these people without a doctor, the more people that you see, the more busy that you get. And unfortunately, you're trying to help so many different people that as a result, many people are not going to be happy. The more people that you want to try and help because you don't want them to go without a family doctor reduces the amount of time that you get to be in clinic. And it's this fine balancing act you have to decide how to make for yourself in terms of how do I still see my own family while at the same time treating as many sick people as I can so that they go without not having a doctor. And then on top of that, making sure that the ones that I am seeing don't hate me because I'm trying to do so many different things. And that's, before I was a doctor, I was just a regular guy. And these are concerns that my family and I have talked about forever in terms of, our family doctor only being able to talk to me for 7 minutes when I went and saw them because they were so packed with their day. And now being on that end of the spectrum. All this to say, when this person actually came in to talk to us and tell us all about handling medical complaints and how it all works, I just asked, I said, hey, what are the most common medical complaints that a family doctor might get, for example? And most of the time, they've actually put it up on their website. It's complaints about staff, complaints about cleanliness of the office, complaints about the doctor not spending enough time with them, about only saying that they could talk about one complaint per visit because they only have so much time to talk about one complaint. And they've now developed a website on the CPSO so you could actually go ahead and see any commonly related answers to the questions that you're asking. One of them being, my doctor is charging me for some services. A lot of people think that everything should be covered under OHIP, but the fact of the matter is that it's not. And I think that many of these complaints here that don't constitute medical malpractice might just be because I think for a very long time we've done a really bad job communicating what it's actually like to be a doctor, how it all works. And many people, they get upset when you're charging $50 to remove a skin tag, for example. It's not covered by OHIP and you need a way to recuperate some of the costs and for your time. I just think that there's a lot of misunderstanding when it comes between what your doctor's actually experiencing and what goes on behind the scenes and what you see as a result. The last thing I'll say about that, however, once again, not trying to disguise or hide any bad doctors. And for some complaints, some really like actual serious ones, sexual abuse, unprofessional conduct, inadequate care, you could always go ahead and fill out one of the complaints on the CPSO if you have something like that, and they will investigate every single complaint that you start. So to any new doctors out there, any new medical students going through the process right now, I guess my advice and what I've learned and what I'm going to be approaching my own practice, I would say it's a large part of our job to be involved in customer service. And I know that that's not what people expect being a doctor to be, but I have a lot of experience in customer service, working at the community center and working in retail before. And a lot of what I do now, doesn't matter if I'm on service in ICU or emergency medicine or my office, there's a lot of customer service involved. And that's something that I keep in mind always, just the way that I talk to people, how I look when I'm at the office, the words that I choose to say. That's number one, is what I would recommend. Aside from that, the advice of chart everything and chart well and make sure you document exactly what you said and follow medical guidance and your training, all things that you'll learn as you go through, especially in residency, becomes really important to learn about that as well. And finally, don't let it keep you down. Don't let the fact that you will eventually receive a complaint from someone stopping you from being excited about doing the job that you do. Because unfortunately, I know many doctors that have stopped working because they just fell out of love with the job. And I think that's something that happens inevitably with any job, but it's something that gets expedited behind these bureaucratic procedures and the fact that every single complaint that gets levied against you does get investigated. And I could see exactly how that weighs someone down and makes them not want to work anymore and not want to see people, and especially not want to see a lot of people. But as always, push through, use your time in training to set yourself up right and be able to avoid these things as best as you can. And don't take it personally. Eventually, everyone gets complaints, and I'm gonna knock on wood, and I hope it doesn't happen to me for a very, very long time. But I will say that YouTube's done a good job for preparing me so far and responding to comments and criticisms and things like that. But I hope this video was helpful. I hope it sheds some light on the process of being a resident and getting ready to face this stuff here. Yes, the last little bit of residency, you have to look into getting a good accountant, getting a good lawyer, setting all these things up in advance and figuring out the legal aspects too. And that's exactly where we are right now with 5 months left of residency. But with that, we'll see you all in the next one. Everyone take care.